Good evening, Dr. Shabina. My name is Jayalinda Balan, and today's presentation is in relation to psychopathology eating disorder. So, before wasting any time, let's go to my first slide. Okay, moving into my first slide. First and foremost, ladies and gentlemen, you've got to know what is eating disorder. Eating disorder can be actually, people might think that it's a common practice among people, they don't eat and then they go into a diet program and things like that. That is a common thing. One should understand what is eating disorder, whereby many might think that eating disorder is a common practice, like what I see just now. So, in which eating disorder can be something very, very serious as well. Because looking at the current situation these days, yeah, most people they are on a diet program, whereas sometimes you wouldn't know what kind of diet program they're in. They will just look normal like you and I, but we don't know what is exactly going into them. So it's a serious mental and physical illness, according to professionals like counselors and psychologists and psychiatrists, where they are said to be having a very, very serious mental and physical illness categorized by abnormal eating habits. So, what is abnormal eating habits? Abnormal eating habits are something where it's an obsession with your body, whereas you want to become thin, you want to look good in people's eye, but you don't understand that the seriousness of going into a diet program, or you don't eat and you go into starving, that can be a very serious mental illness as well. So it's significant, uh, say to it, it's more into an emotional distress one normally undergoes. So in the contemporary counseling setting in 2026, where now at this present generation, this issue is becoming seriously, increasingly very, very critical among people, teenagers. It can be even adults. It can even be you and me. So we wouldn't know what is exactly happening. So I have come up with an assignment explaining on the eating disorder of we have got several eating disorders there, but I've chosen one, so I will explain on that, which I feel comfortable, and I've put in certain several cases which has been referred from the journal, and real cases experience as well, and the uh, counseling procedures, where how counselors are actually like certified counselors handle clients who has got eating disorders. Okay, moving into my okay, ladies and gentlemen, there are several eating disorders actually. So I have chosen on one, which is the anorexia nervosa eating disorder, which I feel that looking at the present generation, most of the adolescents, teenagers, as well as adults, and even old people, married women, they normally try to go into a diet program that leads them to something tremendous after which, because when you are thin you would prefer to be even thinner, but they don't know the consequences of going into a very, very serious diet program. So that will be discussed later on. So moreover, the main eating disorders that requires counseling intervention includes anorexia nervosa, which is an extreme restriction of food intake, extreme fear of weight gain, and distorted self-image. And the next one is bulimia. People might think, what is bulimia? Bulimia are the medical terms of a person who is going extreme in their diet. So they are called as bulimia, a cycle of binge eating followed by unhealthy compensatory behaviors, intentional vomiting. That means what these people do is they eat, after which they will go and vomit it out. So it's a belief where you eat, you are forced to eat, or probably they are so tempting into eating that particular food or a cake or something like that. They eat and they will say, okay, I'll see you later. And they'll go to the toilet and they will vomit the food out. So this is a disease as well. Laxative use and excessive exercising. So where people, they go to gym and they exercise non-stop. Because even if you go to gym, you've got limits in exercising. But some people, just because they want to be very, very thin, they tend to do things like this. So binge eating disorder is a very common practice as well. It's a serious mental condition. It's serious actually, even though it's a common thing among people, but it's a very serious mental condition in which a person eats very large amount of food repeatedly without control. So some people, you can see them, they eat and eat. You'll be shocked to see even after one burger, they go to another kind of food, another kind of food. It continues like that. So it suffers. They eat quickly. It's like they don't have a discipline in probably having some eating ethics where you got to go slow, but no, they eat quickly and they have it in a full portion, and they feel ashamed or guilty after eating. After eating, they might feel guilty and ashamed, but they are not bothered about it because it's a disease. Actually, sometimes you wouldn't know what they are going through. So these are some of the types of eating disorders. And okay, ladies and gentlemen, these are even the extension of eating disorders where people are suffering these days. So bulimia nervosa is an eating disorder. On the other hand, is it's actually a cycle of binge eating followed by unhealthy compensatory behaviors. They deliberately vomit. Uh, like it's an excessive way of proving something. They after eating they go and vomit, and then they go to gym just because they want to be very thin. So they tend to do things like this. Yeah. So anorexia nervosa is something where you it's a fully restriction of food where you want to be very thin. Yeah. So avoidance or restrictive food intake disorders are people who avoid food based on sensory characteristics of fear of the effects of eating. So they are very restrictive, very avoidant. They don't want to eat, not because of body image. There are people who are normally avoid by smelling the food. So sometimes, some people, when they tend to go into a restaurant or when they tend to, um, go out with a friend and things like that, it's just that they don't like it. They don't like the smell of food. They try and say, I don't like this. They're very negative about things they don't want to eat and things like that. So they avoid. This is how they avoid food. And you've got orthorexia nervosa eating disorder, who are people who has an unhealthy obsessive into cleanliness, where sometimes they feel like, oh, I don't want to eat, it's very dirty, the shop is very dirty, the food is very dirty, everything is very unhealthy and dirty for them. And this is how they avoid food, by making others believe that probably they are very very health conscious, and they're very socializing kind of person, but they don't want to eat because probably they feel that eating at home is better rather than eating outside. They're very cautious about things, but actually, in the actual fact is they have got a disease if if it's medically proven. And these are several types of eating disorders. And going into my next slide, I've got a picture here of anorexia nervosa, a girl who probably she had normal weight, a common looking girl, after which she became like this. So this is a very common practice among people in the US, people in the UK, and even artists, film stars, where you can see them in one movie, they are normal. After which you go like, wow, she's so thin. How did she lose weight? So it can be excessive weight losing as well, and many other things involved. So this is one of the pictures. And going into my next slide, let's go into the counseling services in Malaysia and the statistically proven uh, departments and public services in Malaysia. So counseling services in Malaysia are not only based in educational institution, but they have grown actually rapidly in the government and private agencies. Like once we finish our studies, we are categorized as a registered counselor. You've got to register with LKM. So Lembaga Counsel Malaysia. And once you're a registered counselor, you are categorized as a professional registered counselor. And since 1980s, with the establishment of psychology and counseling unit by the Malaysian Public Service Department, so we work together. And counseling services is healthcare institutions aim to make sure they understand, they evaluate, they do a session accordingly in a very professional way. Anybody can be a counselor, but only a registered counselor can have a proper session with a client with the proper theories involved, with the proper guidance involved, with the proper protocols involved, based on the law given by the law enacted by the Lembaga Council Malaysia, the Malaysian Board of Councillors. And it's actually to understand and to be able to cope with feelings and emotions related to the health problem of certain candidates or clients or deponents. And there are many other issues as well, but this is one of the issue: eating disorder. Yeah. So like what I said, to be a registered counselor, uh, you will be able to have a session and to guide. So you are a savior. So after which, if you feel that you cannot handle the client, if it's going extreme, then you've got to refer it, or probably when it's you need to diagnose something, you've got to refer it to the counselor, sorry, to the psychiatrist or the psychologist. Okay, going into my next slide. Psychopathology overview. So what's my opinion about this? I feel that psychopathology is the branch of science that studies the causes, the development, and the manifestation of mental disorders and abnormality in behavior. So, this is where behavior comes in. It aims to understand the drastic changes in emotions, thoughts, and behavior that affects on individuals' daily functioning. And that's where psychopathology comes in. It has several main functions in understanding mental disorders. So, study of disorders, examining various types of psychopathology, where it's more of to understand people's inner side of the mental disorders that they are suffering. So, identification and classifications is using a type of classification system such as the DSM, as well as using the manual statistics of mental disorders systematically, and to understand the clients. So understanding causation. So what do you mean by understanding causation? It's a studies of genetics, biological, psychological, and the developmental of mental disorders to understand the clients, where they're assisting them in planning, developing their mental disorders in a very cognitive way. You have theories with them, you give them homework, you guide them, you make sure they have the confidence and things like that. Okay, going into the next slide. The causes of mental disorders are complex and multi factorial. That is where there is no single cause of all disorders. Contributing factors includes genetic factors. It can be anything. It can be genetics, environment, it can be peer pressures. So a family history of mental disorders can increase a person's risk of developing the same disorders. So biological factors plays a very important role as well. Chemical imbalances in the brain damages, or other physical health problems that might be involved in the developmental of mental disorder. Social factors are very important. Social isolation, discrimination, poverty, it can be racial discrimination, it can be many things. And nowadays, it's a very common thing in Malaysia. It can be among adolescents, among students, among working adults. People are very, very stressed. So how do you help them? And who are there to help them? So this is when the counselors come in, the psychologist comes in, and the psychiatrist comes in. Looking at my next slide, let's go into the cognitive behavior. So human development is a lifelong process. Human development begins in infancy, followed by early childhood, middle childhood, and then the adolescent and the maturity in the adulthood. This is when the human chart comes in, and it's human development. It's one of the subjects in counseling as well, human development. So developmental stages comes in. So the biopsychological model views human development as the results of the interaction of biological, psychological, and social factors. So what do you mean by all these? People might get very confused with the medical and psychopathology way of explaining, the psychologist way of explaining, because counselors are something different. Psychologists are something, they're more into the medical term. So biological elements include genetics and health issues. It can be an inherent current as well. Psychological elements involve cognitive aspects and person's development. So sometimes it can be due to genetic issues. People are it's just inheriting a lot of stress and um, issues in themselves due it's because of their generation. So I've put in some cases in my slides as well, and the cases explains the explanation. And looking at my next slide, this is a case study on eating disorders among teenagers. I normally like to focus on teenagers because being as an academician as well, apart from the legal qualifications I have, I normally see a lot of clients. I see a lot of students. I see a lot of adolescent. I normally go for sessions when I was in my when I was studying previously, and I normally give a lot of talks and things like that for secondary school students on career guidance. And sometimes I do talk to them if they've got any personal issues. They are welcome to share with me in a professional way. So eating disorders are conditions that involve persistent eating behaviors and causing changes in the absorption of food. So it's very disrupting. It's a physical health seriousness actually. So this kind of thing, sometimes you might be wondering, how does it happen and to whom does it happen? It happens to everyone. And you can see, looking at this present generation, in this era, in this globalization, adolescents as well as university students and teenagers are always involved in looking very thin. They want to be very thin. They want to be pretty. They feel by being very thin, it's a competition among them. They always look at their body figures. They compare themselves with their friends and things like that. And it can be an issue or a what you call mental stress or pushiness by their family members or probably by their spouses or by their boyfriend. You have got to look thin. If not, I'm very embarrassed to go out with you. So this is a mental um, stress thing given by third parties. Okay, the number of people with eating disorders has increased worldwide for 50 years. The last in the United States. This is in the United States, whereas in Malaysia there are as well. So it's proven that 500,000 women um, who has been diagnosed as for the anorexia nervosa disease. And this is in the US, whereas in Malaysia, there is as well statistics saying that majority of people or clients or patients who are involved in this are actually quite a number. And 1.1, there is also a statistic saying that 1 or 2 million women is they are met in diagnosing criteria of certain bulimia kind of diseases and all the other eating disorders as well. And going into my next slide, looking at the psychopathological review on mental disease, people with anorexia nervosa have a fear of excessive weight gain. So they feel that if you have put a bit of flesh, if you are a bit chubby, you're not good looking. So this is the mental concept the patients, clients, and deponents who are involved in this mental disease or probably in this body disease. Yes. So they generally resist hunger. They refuse to eat even though he or she is hungry. Even they're hungry, they starve. So this statement is supported by the Permatasari 2012. It's a case study actually. A person suffering for anorexia nervosa is aware of his hunger, but usually they refuse to eat. So this is one of the case studies that I've researched on. According to Bruch in Berman 2024, states that anorexia nervosa is not just an eating problem or body, but it's a deeper disorder involving a very involving a perception and identity and control over their food factors. And let's go into my next slide, counseling and psychological review sessions. Counselors usually, it's a use of, they use variety of therapies. And being a counselor, a registered counselor, you cannot only focus on one session or on one theory or probably one session, or you are just rigid into one way of kind of what do you call communication or session handled. You have got to have knowledge. You have got to have a vast knowledge on your theories, on your protocols, and the way you handle a client. So CBT is a very important theory used by counselors normally. It's cognitive behavioral therapy where behavioral diagnosis and behavioral changes. Being a counselor, you have got to make sure after several sessions your client goes out confidently, not a lot, not 100%, but probably at least about 70 to 80% going out of the session confidently. You give them homework, you give them training, you give them to understand they will need to have certain things where the behavior has got to be changed a little bit before the session ends. So it helps patients identify and change incorrect, distorted kinds of patterns about their body shape, weight, their food intakes, and their confidence level. So family therapy is very important as well. Focus psychodynamic therapy is very important as well. It helps patient understand the internal conflicts that causes eating disorders. Group therapy. This is group counseling. So maybe you have got a large group of people who has got anorexia, but you can't see, but they know themselves. But probably they have got different kind of eating disorders as well, and they have got something where they want to be very thin. So when you have a group session, at the end of the day, they might be very reluctant. You might have issues with group sessions candidates where they don't want to cooperate. They are very aloof. They're very judgmental and things. So as a counselor, what are you supposed to do? You have got to have the confidence level in handling a group session when you have candidates who comes in with the similar or identical issues. Okay, looking at my next slide now without wasting any time, why does this happen and what are the causes? According to what I've researched and through my knowledge, I feel that anorexia nervosa can be influenced by several factors. According to cases, it's case basis. It can be due to environment, peer pressures, people in your house pressuring you, pressuring saying that you're fat. So what you're going to do? It's an inferior complex you have. It's an inferior complex. You become very inferior about yourself. You feel that okay, how to become thin? I don't want to go to the gym. I don't have money. I don't have time. So what do? You tend to have this inferior complex in you, this anxiety in you, this stress in you. You will tend to avoid your food probably a little bit first. Then when you see changes in yourself, it leads you to probably having uh, probably having a liking to go more and more into your habit of not eating. So it's a belief system in your mind that by not eating, I will become thinner and thinner and thinner, and I can prove to the world that I'm able to become thin. So this is a disease as well. So research done by Talva, its case basis 2011, states that self-esteem is something very important, and people have the tendency to have low self-esteem, that their physical appearance is no good, and they often compare their body with others. They're being body shamed, and they feel that they don't fit into the society. So this is a very serious things, serious disease and serious thing among people, which is which has been going on from those days, but now the competition is even more higher, and the it has been proven that people are very, they take their body figure a very serious thing, where it can be also proven from what is happening in the social media these days. Too many detox products, too many products, you know, uh, unapproved products. So these kind of things. Looking at my next slide is the comorbidity patterns of anorexia disorders. Depression is a complex mental disorder, actually. So often understood through multiple interrelated perspectives, particularly the psychosocial model, and also probably it is not just a simple sadness, but it's a persistent mood disorder. That's what it's meant actually, causing fatigues, hopelessness. The following is a comparison of perspective, strength, limitations, and tensions in understanding and treating depression. So, as I said, depression is a very common thing these days. Everybody is depressed, it's just that we can't see sometimes. And it focuses on how individual interprets their experience, social environmental issues, their biological, psychological, and the cause of it, maintenance of depressions. How do you do that? It can be a childhood trauma as well. People have been always saying that you're fat, you're fat, you're fat. So these are the patterns normally where people go through a lot of eating disorders. And the eating disorders, one of it that I'm talking about is the anorexia disorders. Okay, ladies and gentlemen, let's go into the statistics on depression among Malaysians. Just now, I explained about the Americans in the United States. Let's go into the statistics depression on Malaysians now. According to the National Health and Morbidity Survey (NHMS) 2023, 1 million or 4.6% of Malaysians aged 15 and above suffers from depression. a double increase compared to 2019. And the study shows a significant increase. It's an increase actually in cases among teenagers 16 to 25 years old, like what I mentioned just now, and with almost half having thought about harming or committing suicide. So why do they want to commit suicide? It can be a depression thing as well. Probably they feel that they can't come up to the extent. It can be peer pressures, it can be environmental issues, it can be probably they have fallen sick after a lot of having a lot of what you call they're focusing more on becoming thin, and they go into eating disorders, and it's a thing that your body cannot take it. You are below, or probably you can't even say that you're average, probably you're just below the level of body weight a normal human being like you and me should have. So mental health can have an impact on an individual's daily life and future. Treating and preventing mental health from an early age is very important and can help individuals develop better future and a better understanding. So the World Health Organization, WHO, 2008, found that approximately about 450 million people worldwide are diagnosed with certain mental health disorders such as depression, schizophrenia, and bipolar disorders. So these are actually the terms where, due to eating disorders and due to all these kind of disorders where um, it can be a reason of the eating disorders that one suffers, a patient or a deponent or probably a client who comes to you, you wouldn't know. So this can be an interrelated disease where it leads to many other consequences as well. Let's go to the counselor's goal and priorities, because at the end of the day, you see, ladies and gentlemen, we are future counselors, so we've got to understand from the counselor perspective of it. We cannot look at it in a psychologist or in a psychiatrist view of it, because normally psychologists and psychiatrists, they just need solution. You come straight to the point, you give medication, you diagnose something, whereas counselors are different. Counselors will have to understand the client first, then you can understand what's going on. So the main type of psychological therapy is to enhance cognitive behavior. Like what I said, behavioral practice is very important. So CBT plays a very important role. And family-based treatment approach, a highly recommended therapy for adolescents in which the family will be actively involved in this. And you have got this Maudsley model of anorexia nervosa treatment for adults, where this therapy is actually used for adults and focusing on the cognitive part, emotional, and to rationalize factors when you come across patients who has got this anorexia disease. So interpersonal therapy helps patients addresses interpersonal relationship to contribute eating disorders, motivational enhanced therapy. So all this therapy is very important for a counselor to have knowledge on, as well as the cases involved, real case studies involved, as well as the theories involved in having a session, diagnosing the problem. You have to build a rapport. You have to have what you call interrelative understanding with the client, and then you can have the sessions with the client. Going into my next slide, ladies and gentlemen, factors that may lead to eating disorders. There are many factors actually. Let's go into one of the very, very crucial factors: poor communication patterns between spouses. It can be a reason as well. You see, nowadays, married women, they're very inferior about their body. They always want to look thin. So how do you do that? You are pressurized by your husband, probably by your in-laws, or probably by your children as well. Mama, you look very fat. You look very fat. You look very fat. So what are you going to do? You're going to have stress. And women from problematic family background, lack of communication, you don't have good communication skills with your spouses. So at high risk of engaging in normal eating behavior. You might be sad, you don't eat. You might feel inferior, you don't eat. So it's a productive kind of pattern, negative moods and stress among married women. Looking at my conclusion, without wasting any time, I feel that, in my opinion, anorexia nervosa is a form of intense fear of gaining weight. And it can be due to many reasons as well, or refusing to maintain a weight at or above the minimum normal body weight for age and height, and experiencing disturbance in the way one views one's weight or body shaping. You might be body shamed and you feel uncomfortable about it. Therefore, it causes a variety of serious complications that can even cause death. And sometimes when people feel that they cannot come up to that extent, they tend to have negative emotion. That's when schizophrenia, bipolar disorders, and all this comes in because of all this. So it's an interrelated kind of diseases. Suffers from those sufferers, or probably clients or patients who are undergoing many types of eating disorders, which my one is more onto the anorexia nervosa, or any other eating disorders for that matter, need comprehensive medical counseling, psychological treatment. In order, it's a belief where a certified counselor or a psychologist or a psychiatrist would be able to cure and bring them back their into themselves, into their normal self. And they need serious medical attention, namely hospital treatments. If necessary, an individual or family therapy would be better to have in order to avoid any negative actions by the clients or patients. So, this is in a nutshell, I feel, as a counselor plays a very important role in overcoming the issues, or probably you cannot advise your client, but probably you can help your client to come up with a solution in the sessions. So this would be a very important thing, or probably the goals counselors should have in order to make sure the sessions and the clients, uh, it's beneficial to the client. And this is the okay, ladies and gentlemen, this is my final slide, and these are the references that I've taken for the research. The methodology that I've used in my assignments are more of research program. It's a research, it's a philosophical research of psychopathology, eating disorder. And the main aspect that I discussed on is the anorexia disorders. And thank you so much for hearing. And I hope that the research brings lots of benefits to myself, as well as to the person who's hearing, to doctor and the other candidates who wish to hear. And I'm open to questions based on the assignments and the slides that I've presented. Thank you so much and have a good day.